Hi, I'm Dr. Lauren Kiss from the Centers for Disease Control and Prevention. Today we'd like to educate you about a very serious disease which has been around since biblical times. Leprosy, otherwise known as Hansen's disease, is caused by Mycobacterium leprae. While 95% of the world's population is immune to leprosy, there are still over 200,000 new cases reported each year.
I was on a family vacation in Madagascar last year. We spent a lot of time in rural areas with local residents, the surrounding areas teeming with poverty. We were visiting with a family whose child was very ill and coughing and sneezing a lot. Her mother said that she had started showing signs of sickness after visiting an armadillo habitat. Sadly, we found out too late that she had contracted leprosy from the bacteria carried by the armadillo. When I returned to the United States, I realized that I, too, developed symptoms of leprosy after coming in close contact with the girl who had been sneezing. I now know that the disease spreads by nasal secretions carried by the bacteria being projected into the air through coughing and sneezing.
I, too, contracted leprosy through contact with someone who had the disease while I was traveling in Brazil. At first, my symptoms were mild and included a stuffy nose, nosebleeds, thick skin, and numbing in my hands and feet. Within a few weeks, I developed ulcers on my feet, loss of sensation, enlarged nerves, and severe pain. By the time I got to see my primary care physician, I also had developed skin lesions, growths, and muscle weakness, and paralysis. Today, I am almost totally blind and have lost some of my fingers and toes.
If Jillian and Nicholas had realized earlier what was happening to their bodies, much of their suffering could have been avoided, since early treatment is crucial to preventing damage. If they had visited a doctor when they became aware of the earliest symptoms, they could have been put on a regimen of MDT, or a multiple drug treatment. This would have included 6 months to 2 years on a combination of antibiotics and anti-inflammatory medications. The United States has special clinics for people with leprosy. Here they receive the medications and special treatments needed to overcome the most serious effects of the disease. While the course of the treatment cannot cure or reverse damage already done to a person, it will prevent further, more serious harm.
There are several steps you can take to avoid getting leprosy.
First, if you notice any of the symptoms that I described earlier, go to a doctor immediately. Early diagnosis is extremely helpful, and it's better to be safe than sorry.
Also, avoid contact with armadillos. They can carry Mycobacterium leprae without showing any symptoms of leprosy whatsoever.
Do your best to steer clear of anyone who has leprosy.
Do not come in contact with other bodily fluids, such as secretions.
We need your help to raise awareness of this disease. Though there are medications to help those with leprosy, the disease has yet to be eliminated from Earth. If you or a loved one have been to any of these high-risk countries or are experiencing multiple symptoms, go to a doctor immediately. Untreated leprosy leads to severe, permanent damage, as shown in these pictures.